Hello, my name is Elizabeth D., and I am a public health analyst in the Office of Disease Prevention and Health Promotion, or ODPHP. ODPHP is within the U.S. Department of Health and Human Services and manages the Healthy People Initiative. And I'd like to welcome you to the third webinar of the Healthy People 2030 webinar series. Next slide, please. Through this series, ODPHP, with the statistical expertise of the National Center for Health Statistics, aims to feature the latest data on Healthy People 2030's leading health indicators, overall health and well-being measures, and other Healthy People 2030 objectives. Each webinar, we feature states, communities, or organizations working to achieve the Healthy People 2030 targets through the implementation of evidence-based interventions, programs, or policies. You can stay informed on these webinars by joining our Healthy People listserv to learn about the dates and themes of the upcoming events. Next slide, please. Today's webinar is titled Cancer Prevention and Healthy People 2030, Goals, Objectives, and Implementation. During today's webinar, we will first hear from Carter Blakey, Deputy Director of the Office of Disease Prevention and Health Promotion, who will present on the importance of the 3 objectives featured in this webinar and explore how the objectives relate to cancer prevention. Following Carter's presentation, we will hear from Dr. David Wong. Dr. Wong is the Chief of the Health Promotion Statistics Branch at the National Center for Health Statistics, and he will provide details on current progress toward meeting objective targets for the 3 Healthy People core objectives featured during today's webinar. Dr. Wong will also review differences observed across population groups. Lastly, 3 speakers from the South Dakota Department of Health will share details on their statewide cancer prevention efforts, including physical activity. We are looking forward to hearing from Beth Davis, Nikki Prosh, and Lexi Pugsley, and learning how their work touches on the 3 objectives featured here today. We will have moderated Q&A at the end of this webinar with these speakers, as well as with several subject matter experts who you can see on this slide on the 3 featured Healthy People 2030 objectives. We encourage you to please submit your questions into the Q&A box, which should be at the bottom right of your screen during today's presentations. We will do our best to address as many of your questions as time allows. And with all of this, it's now my pleasure to transition the webinar over to Carter Blakey to provide the overview of the theme in today's webinar and featured objectives. Carter.
Great, thank you, Elizabeth. So next slide, please. So today's webinar will feature 3 core Healthy People 2030 objectives, which are listed here on this slide alphabetically. So from the immunization and infectious disease topic area, the objective is increase the proportion of adolescents who get recommended doses of the HPV vaccine, or IID-08. From the physical activity topic area, it's reduce the proportion of adults who do no physical activity in their free time, that's PA01. And then from the tobacco use topic area, it's reduce current cigarette smoking in adults, or TU05. So these 3 objectives are Healthy People 2030 core objectives, which means that they'll be tracked throughout the decade, and progress toward achieving these objectives targets will be updated as data from its specific data sources becomes available. So included on the right-hand side of this slide are more information about what it means to be a core objective. So one of the objectives, the current cigarette smoking in adults, has been further elevated as what we call leading health indicator, or LHI. And the LHIs are a small subset of high priority Healthy People 2030 objectives that we've selected to address critical public health issues and then to drive action toward improving health and well-being of the nation. So next slide, please. So before we begin discussing these objectives, I think we really must acknowledge the COVID-19 pandemic. So the pandemic has affected almost every part of our lives, and it's important to recognize that those impacts on the Healthy People 2030 objectives we're reviewing today as well as all the objectives across the decade. And the pandemic has influenced the overall health trends in the United States. And then additionally, it's impacted the measurement and data collection efforts for the data sources, including national databases that we use for Healthy People 2030. So in the next few slides, I'll review the connection between the human papillomavirus, vaccination, physical activity, and cigarette smoking and cancer. So next slide, please. So the human papillomavirus, or HPV, can lead to cancer in both men and women. HPV infections and cervical precancers, which are abnormal cells on the cervix that can lead to cancer, have dropped since 2006 when HPV vaccines were first used in the United States. So clearly HPV vaccination is cancer prevention. HPV vaccination could prevent more than 90% of cancers caused by HPV from ever developing. So this translates into an estimated 33,700 cases in the United States every year. Then understanding the factors, including the social determinants of health, that can influence vaccine uptake is critical to ensuring vaccine coverage across populations. So the Healthy People Objective IID-08 tracks the proportion of adolescents who get the recommended dose of HPV vaccine. Vaccinations and other methods such as screening are important ways to lower cervical cancer. And Healthy People 2030 also includes other related objectives, including one on cervical cancer screening, which is to increase the proportion of females who get screened for cervical cancer. So next slide, please. So everyone needs aerobic and muscle strengthening physical activity, according to the physical activity guidelines for Americans. And the physical activity guidelines provide evidence-based guidance to help Americans maintain or improve their health through physical activity. So doing regular physical activity is one of the most important ways that people of all ages can improve their health. The level of physical activity recommended in the guidelines are associated with a reduced risk of developing many cancers, reduced mortality, improving the quality of life and fitness for cancer survivors. And being physical activity lowers your risk for developing 8 commonly occurring cancers. And physical activity can also help delay, prevent, and manage many chronic diseases. But not everyone has the same opportunity to be physically active. Many people live in neighborhoods with poor sidewalks and street infrastructure, few safe spaces for physical activity, and few destinations, including transit stops, within walking distance or biking distance from their home. So ensuring access to physical activity opportunities for all Americans is a critical step toward achieving our Healthy People vision, which is a society in which all people can achieve their full potential for health and well-being across the lifespan. So the Healthy People 2030 objective, PA01, tracks the proportion of adults who do no physical activity in their free time. So increasing physical activity is an important national health priority, as physical activity is one of the best things people can do to improve their health. And it's vital for healthy aging, and it can reduce the burden of chronic diseases and prevent early death. So next slide, please. So the third featured objective in today's webinar measures cigarette smoking in adults. Tobacco use is the leading cause of preventable disease, disability, and death in the United States. The cigarette smoking causes cancer and early death, and cigarettes are the most commonly used tobacco product among U.S. adults. So smoking harms nearly every organ in the body, causing many diseases, affecting the health in general. So the U.S. Surgeon General has concluded that cigarette smoking causes 12 different cancers, and smoking is linked to approximately 1 in 3 cancer deaths, including 9 in 10 lung cancer deaths. So cigarette smoking, quitting has immediate as well as long-term benefits for individuals and their loved ones. Tobacco-related disparities are challenging problems created and affected by a complex mix of factors, including, again, the social determinants of health. So understanding factors that influence these differences can help shape policies, programs, and practices to address this public health priority. So with that very brief overview, I'd like to turn the webinar over to my colleague from the National Center for Health Statistics, David Wong, who will review the data and any progress we've made on these objectives. So David, the webinar is all yours.
Great, thanks so much, Carter. Next slide. It's a pleasure to be here with you today to share data for the 3 Healthy People 2030 objectives chosen to frame our discussion on cancer prevention. As Carter mentioned in her presentation, the measure on adult cigarette smoking I will discuss today is a leading health indicator, or LHI. The other 2 measures I will cover track adolescent HPV vaccination and adult physical inactivity. Next slide. I will begin by discussing HPV vaccination of adolescents 13 to 15 years. Next slide. This is the 2nd decade that HPV vaccination has been tracked in healthy people. However, last decade, HPV vaccination was tracked by 2 separate objectives, one for boys and one for girls. This decade's single HPV vaccination objective tracks the proportion of all adolescents aged 13 to 15 years who received the recommended doses of HPV vaccine. Note that the Advisory Committee on Immunization Practices, or ACIP, recommends 2 doses of HPV vaccine for adolescents who initiate vaccination before their 15th birthday, and 3 doses for those who initiate vaccination on or after their 15th birthday. HPV vaccination is tracked using CDC's National Immunization Survey for Teens. Next slide. HPV vaccination of adolescents 13 to 15 years increased by 13.5% from 48.0% in 2018 to 54.5% in 2020. Throughout my presentation, when discussing race and ethnicity, we'll look at Hispanic ethnicity alongside racial groups, all of which exclude persons of Hispanic origin. Here we can see that between 2018 and 2020, vaccination rates increased among Black, White, Native Hawaiian, and American Indian adolescents. In 2020, American Indian adolescents had the highest HPV vaccination rate at 71.7%, followed by Native Hawaiian teens at 67.7%. On the other hand, white adolescents at 51.0% had the lowest rate. Next slide. In this slide, we show HPV vaccination rates by sex and family income. The HPV vaccination rate was higher among girls than boys in 2020, 56.4% versus 52.6%. The vaccination rate was highest for adolescents and families with incomes below the federal poverty level. In 2020, this rate was 23.2% higher than those from families at 200 to 399% of the poverty level. Next slide. We'll now focus on HPV vaccination rates by geographic location and health insurance status. In 2020, adolescents in metropolitan areas and those with health insurance had higher vaccination rates compared to their counterparts. HPV vaccination rates were 19.3% and 32.6% higher, respectively, among adolescents in metropolitan areas and those with insurance compared to their counterparts. Next slide. I'll now turn my attention to physical activity. Next slide, please. It should be noted that in 2019, the National Health Interview Survey, or NHIS, was redesigned. Due to this redesign and the release of the updated 2018 physical activity guidelines, the original Healthy People 2030 baselines have been revised to the year 2020 and are not comparable with the 2008 to 2018 Healthy People 2020 objective data. The physical activity questions are now asked biennially instead of annually on the NHIS, so 2019 and 2021 physical activity data are not available. Also, we are therefore not able to evaluate whether there were any changes in physical activity associated with the COVID pandemic. No leisure time physical activity or physical inactivity is defined as adults aged 18 years and over who report that they never do or are unable to do moderate or vigorous physical activity. Next slide. In 2020, 26.1% of adults aged 18 years and over engaged in no leisure time physical activity. Women had a slightly higher rate of physical inactivity than men, 27.7% versus 24.4%. Physical inactivity increased with advancing age. The physical inactivity rate for adults 85 years and over, 56.5%, was more than 2.5 times the rate for adults aged 18 to 24 years at 19.8%. Next slide. We can also see differences in rates of no leisure time aerobic physical activity among adults by race and ethnicity. In 2020, American Indian, Hispanic, and Black adults had higher rates of physical inactivity than white and Asian adults. There is a strong inverse relationship between physical inactivity and family income. The rate for those below the poverty threshold was more than 2.5 times that for those with incomes of 400% or more of the poverty threshold, 44.3% versus 15.6%. Next slide, please. Here we're showing leisure time physical inactivity data by health insurance, disability, veteran status, and geographic location in 2020. Adults 18 to 64 years old with public insurance at 35.3%, and those who are uninsured, 34.7%, were nearly twice as likely to report physical inactivity than adults with private insurance, 18.1%. Adults with disabilities were more than twice as likely to report physical inactivity than adults without disability, 53.3% versus 23.6%. Lastly, the rate of physical inactivity was higher among non-veterans and adults living in non-metropolitan areas compared with veterans and those living in metropolitan areas, respectively. Next slide. Finally, I'll discuss cigarette smoking among adults. Next slide, please. Adult cigarette smoking in Healthy People 2030 refers to adults aged 18 years and over who report both ever smoking at least 100 cigarettes in their lifetime and currently smoking some days or every day. Adult cigarette smoking is tracked using data collected annually from the National Health Interview Survey. Next slide. This slide shows the percentage of adults who currently smoke cigarettes in the United States by sex from 1965, when the first Surgeon General's report was released, to our most recent data year, 2021. As I mentioned a few slides ago, in 2019, the National Health Interview Survey was redesigned. Data before and after the redesign had not been fully evaluated for comparability, and therefore we are showing a break in trend. The percentage of men and women who currently smoke cigarettes are both less than 1/3 of what they were in 1965. The percentage decreased from 51.2% in 1965 to 13.3% in 2021 for men, and from 33.7% in 1965 to 10.1% in 2021 for women. Next slide. On this slide, we will take a closer look at disparities in current cigarette smoking among adults in the most recent year, 2021. Asian adults had the lowest rates of current cigarette smoking, 5.5%, while adults who identified as being of 2 or more races had the highest rate, nearly 3 times as high at 15.7%. Rates decreased with increasing levels of education among adults aged 25 and over. The rate for adults with less than a high school education was over 4.5 times the rate for adults with a 4-year college degree or more. Finally, the rate of current smoking was 79% higher for adults living in non-metropolitan areas, 19.0%, compared to those in metropolitan areas at 10.6%. Next slide. The map on the left shows adult cigarette smoking by state in 2020 using data from the Behavioral Risk Factor Surveillance Survey, or BRFSS. The states shown in the darkest blue color had the highest rates. And the map on the right shows lung cancer deaths by county for 2016 to 2020 using data from the National Vital Statistics System. Looking at both maps simultaneously, we can see that lung cancer mortality and smoking follow a similar geographic pattern, with most of the areas with higher rates located in the eastern section of the US, and many with lower rates in the West. Next slide. I will end by sharing some key takeaways. Next slide, please. Adolescent HPV vaccination rates increased between 2018 and 2020. In 2020, more than a quarter of adults did not engage in leisure time physical activity. Due to the updated 2018 physical activity guidelines, we have new baselines, and we will continue to evaluate physical activity trends on a biannual basis throughout the decade. Cigarette smoking continues its decades-long decline. And finally, disparities were observed for all three objectives, including by socioeconomic status, or SES. It is interesting to note that disparities by SES, including education or income, for adult cigarette smoking and physical inactivity were considerably larger than those for adolescent HPV vaccination. Next slide, please. Finally, I would like to thank and acknowledge the work groups, data programmers, and the NCHS staff listed here for their contributions to these slides. Now I will turn it over to our presenters from the South Dakota Department of Health. Thank you.
Thank you, David. South Dakota is pleased to share our efforts supporting the Healthy People 2030 cancer prevention objectives. Next slide, please. The South Dakota Cancer Coalition is funded through the CDC through our Comprehensive Cancer Control Program. This program leads both the facilitation of our statewide multi-sectoral South Dakota Cancer Coalition, as well as the development of our statewide South Dakota Cancer Plan. This cancer plan is the fourth iteration that's been released by the Cancer Coalition, and our coalition is really made up of a diverse active membership. Currently, we have over 80 members representing 35 organizations that are actively implementing efforts to increase cancer prevention and control efforts. Our cancer plan includes 12 priority areas, as well as focuses on SMART objectives that address the burden of cancer in South Dakota, including areas among our 4 priority populations, which include American Indians, those of low socioeconomic status, rural and frontier populations, and the underinsured and uninsured. Next slide, please. I'll be focusing in on the 3 priority areas that align with the Healthy People 2030 cancer prevention goals. Those include reducing tobacco use and exposure, increasing healthy active lifestyles, as well as increasing HPV vaccination rates. As you can see, we've set baseline and target measures within our cancer plan, as well as identified key priority populations within each of the 12 priorities. We'll focus our presentation today on the work of our Healthy Active Lifestyle Task Force supporting Priority 2, but I did also want to share on our cancersd.com website, on our Reports and Outcomes tab, we have several reports that highlight our work under Priority 1, as well as Priority 5. We have made great efforts around HPV vaccination rates. As you can see, we've increased those rates by 20% since the baseline of our cancer plan. We do a lot of evidence-based intervention implementation with health systems to increase those HPV vaccination series completion rates. On average, our partners increase their rates by about 10%. So if you're interested in learning more on those efforts, again, please refer to our website. Today's presentation will focus in on the work of our Healthy Active Lifestyles Task Force. Because we do have 12 priorities that span the entire continuum of cancer prevention and control, on an annual basis, our coalition prioritizes the priorities of the cancer plan that will be implemented for that implementation year. Through that process, we identified, based on partner interest, the available burden data, as well as the coalition's ability to impact that effort, that we'd be focusing in on healthy active lifestyles as one of our 3 implementation task forces. And through that partnership, we partnered with the Nutrition Physical Activity Program to address this issue. Next slide, please. Carter did a great job sharing about the benefits of physical activity and its relationship to cancer prevention. In addition to that, physical activity also supports cancer survivors, those undergoing active treatment, as well as has many benefits for cancer survivors with regard to fatigue, anxiety, depression, and really improving quality of life for cancer survivors. So not only is it impactful in cancer prevention, but really across that continuum for our cancer survivors as well. And so with that, I will turn it over to Beth Davis to share more about the Nutrition Physical Activity Cancer Coalition Partnership.
Great, thank you, Lexi, for that great overview of the work led by our South Dakota Cancer Program and partners, and for emphasizing that connection between physical activity and cancer, one of our webinar themes today. As Lexi mentioned, the Healthy Active Lifestyles Task Force identified physical activity as a focus area, specifically to increase the percentage of South Dakota adults who meet the aerobic physical activity guideline of 150 minutes per week to 54% by 2025. The task force also identified a few obesity-related objectives. So by increasing physical activity and reducing obesity rates, we are really hoping to make progress towards the prevention of some cancers in South Dakota. I do want to point out that the task force provided the catalyst and the funding for the physical activity work that we will be discussing here shortly on behalf of Healthy SD, so we want to thank them for that. Healthy SD is our nutrition and physical activity initiative within the department, and we rely heavily on local community leaders and partners to carry out our mission. Next slide, please. These next two slides will provide some context of our physical activity team within the South Dakota Department of Health. Nikki Prosh and I are both contractors that provide physical activity support to our Healthy SD team and work alongside our nutrition staff within the department. Because we are a small team, again, I can't stress enough how much we really rely on our partners in local communities and systems to carry out our initiatives. Next slide, please. So some of the things that we do within our small team of Healthy SD, we make sure that we provide consistent messaging across all of our chronic disease programs, alignment of goals and strategies so that all of our chronic disease programs have the same information, the same guidance, same data. We work collaboratively on developing physical activity model policy and translating physical activity data and guidance, promoting the physical activity guidelines for Americans, and a few other things. So that is kind of our core focus. Next slide, please. So I did want to include one quick data slide to give a quick snapshot of how we're doing in South Dakota with regards to adults meeting the physical activity guidelines for Americans. Our primary data source for this data is our BRFIS, Behavioral Risk Factor Surveillance System, which, as many of you know, is a self-reported telephone survey. We do add an extended state added module of physical activity questions every odd year. So as you can see, unfortunately, we have seen a reduction in the percentage of adults meeting the aerobic physical activity guidelines since 2015. However, we are increasing those that are meeting the muscle strengthening guidelines and those meeting the combined aerobic and muscle strengthening guideline. We are currently having conversations within Healthy SD about revisiting our current physical activity targets for 2025. And we'll look to Healthy People 2030 for guidance in aligning with those physical activity objectives and targets. But we also want to wait and see what our 2021 data looks like, especially given the pandemic, and also want to align closely with our surrounding states when revisiting those targets. So we'll be looking at taking a look at that in the coming months. The key takeaway here is that we know in South Dakota we need another strategy to increase physical activity and reframe physical activity, making it more achievable for all and to get all South Dakotans moving more, removing the barriers to daily physical activity and making it more accessible. Next slide.
Thank you, Beth. To add to the context, I'm going to talk a little bit about our state of South Dakota. So this map on this slide really represents the county health rankings for our state of South Dakota. The data is representative of 2022. So health factors that are represented on this image show community conditions that can be changed. Some of the 30 health factors that are represented in this map and together and put the ranking of the counties by health factors include physical activity, tobacco use, access to care and quality of care, employment, air quality, and housing. So just giving a quick look at our state of South Dakota, you can see the counties shown in the darkest blue show the counties with the lowest health factor ranking, whereas the lightest blue color shows the best healthcare factor ranking. The counties with the gray color are counties that are not ranked. So county health rankings are based on a model of community health that emphasize many factors influence how long and how well we all live. They can be the predictors of how healthy our communities can be and how healthy our South Dakota communities can be, specifically from this image. This map is helpful for our physical activity team as it can help guide some of our statewide work in specific counties or areas in our state to focus on, as well as across our Office of Chronic Disease team. It also connects back to social determinants of health, which is one of the 5 overarching goals of Healthy People 2030, which is creating social, physical, and economic environments that promote full potential for health. Next slide. In addition to the counties and health factor rankings shown on the previous slide, some priority populations for our state, which Lexi mentioned for cancer, also overlap with a number of different chronic disease areas within our department, as well as in our physical activity efforts. So those include, again, just restating some of what Lexi mentioned, American Indians, low SES or socioeconomic status, rural and frontier populations, which really makes up a majority of our state in South Dakota, uninsured, underinsured populations. So there's work happening across the state to address these different priority populations, and again, the different geographical regions represented in the previous slide. We are in early conversations through some of our physical activity work of how we can partner with some of the current work that is happening. For example, community health workers and community health representatives is a really new and expanding workforce for our state. That's something we've had communications about, of how we can connect our physical activity work and programming with this new workforce that's developing in South Dakota. Our South Dakota State University Extension is also doing some great coalition work with 8+ communities to improve nutrition and physical activity efforts. 2 of those coalitions are located on our 2 counties in South Dakota with the highest rate of obesity. So in addition to those quick 2 examples, our nutrition and physical activity team, as Beth mentioned, works very closely with our partners within our department, as well as throughout the state locally and kind of statewide, to implement a lot of the work we do as a physical activity team and also as an Office of Chronic Disease. Next slide, and I'll turn it back over to Beth.
Thank you, Nikki. I'm sure many of you are well aware of CDC's Active People, Healthy Nation and that initiative to get 27 million more Americans moving by 2027. So I want to thank them for this slide, and full disclosure, I use this a lot in my work, but I wanted to include this just to try to provide the context for the next strategy that I'll be talking about with Move Your Way. So you'll see on this slide that community-wide campaigns is on this image. And that is really where we are identifying our Move Your Way project with an evidence-based strategy for increasing physical activity in providing that community-wide campaign resource. So it aligns very well with the work we're already doing as well, which is why Move Your Way appealed to us, which I'll be talking about next. Next slide, please. These are some highlights from both our Healthy SD program, our website, and then also a couple of images from the federal Move Your Way campaign. And again, as I mentioned before, all of these align well with the evidence-based strategy of community-wide campaigns, which provided the catalyst for our work with Move Your Way. Next slide, please. So Move Your Way is a physical activity campaign from the U.S. Department of Health and Human Services to promote the recommendations from the Physical Activity Guidelines for Americans. So it is the implementation campaign for the guidelines. And we were really excited about reaching out to the Move Your Way staff on the Move Your Way materials and the resources, and having that conversation with them around how we could use Move Your Way in South Dakota. And what appealed to us about Move Your Way is that it reframes the conversation around physical activity to include messages such as lots of things count as physical activity, it all adds up, no special spaces or equipment is needed, and so we can promote physical activity within our communities and kind of reduce that barrier that it requires a special time of day, a special equipment, special places and spaces, because we know in a lot of our rural communities, some of that access is limited. So we thought if we can promote these messages of incorporating physical activity throughout your day, whatever you're already doing, things that you like to do, that you enjoy, that get you up and out of your seat and moving more. And because our cancer program provided the catalyst and the funding for our Healthy SD work for this project, we are adapting and customizing one of the resources from Move Your Way, the Community Playbook, which is what I'll be going into next. Next slide, please. So the Move Your Way South Dakota Playbook, again, is an adaptation of the federal Move Your Way playbook. And I do want to just take a second to call out the Move Your Way staff that we've been working with over the last several months. Mallory, Joshua, and Kate, thank you so much for your work and your professionalism. It's been a really great collaboration to work with you. But what we're doing is we are taking components from the Move Your Way playbook and creating our own South Dakota playbook that we feel will be more usable for our South Dakota communities and partners, yet maintain the integrity and the science behind the Move Your Way materials, which is why we are working very closely with the Move Your Way staff on that customization. And we are also including our Healthy Active Lifestyles Task Force on development, feedback, as they are the ones that know our cancer partners and populations and what their needs are. Key audiences for the playbook include our local leaders, health champions, our chronic disease partners and communities, as Nikki mentioned, our community health worker workforce. And I also wanted to mention our WIC partners, as we also received some additional funding from our MCH program, so that they also have a resource to promote with their audiences to increase physical activity. Next slide, please. So in addition to the playbook, which we are kind of calling our game plan, so we have kind of a take on the whole game plan, team, and coaching, those use of those terms for our playbook. We're also developing some ancillary materials to enhance, including a promotional postcard, fact sheets and posters customized with South Dakota images. We're also planning to develop displays and banners for use by our staff, partners, and community leaders. And we are also in very early discussions with some of our partners to possibly pilot our playbook once we have that completed, and to provide more feedback back on how we can customize for our communities and leaders and what their needs are that we may not have addressed earlier. And then finally, I do just want to mention some of our evaluation methodologies that we do plan to incorporate, include some web metrics, some analytics, some traffic to the website where we will be placing our playbook, and then also drawing people to the federal Move Your Way web pages as well, because there's just a wealth of resources out there in addition to the playbook that we will be developing. And then also tracking dissemination numbers of materials, events that are planned, and also utilizing the campaign tracker form from the federal Move Your Way project. So stay tuned for progress on that, lessons learned, evaluation. We're still in the middle of the development, but we hope to have something soon. Next slide, please.
Thank you, Beth. So to talk a little more about another project that was one of the priority focus areas of our cancer program is our Park Prescriptions program. So in 2014, a small group of professionals made up from different partners, which primarily did represent our South Dakota Department of Health, South Dakota State University Extension, and South Dakota Game Fish and Parks came together, and really the goal of the work group was to determine a way to further connect physical activity within the healthcare sector. So something that came out of that work group was the development of the Park Prescription Project for South Dakota. So ParkRx, or Park Prescription, is implemented again through the strong partnership of the 3 statewide organizations. How ParkRx works is providers, healthcare providers across the state can sign up online, request that they're sent a Park Prescriptions kit, and they receive all the materials they would need to implement the ParkRx in their facility or their clinic, wherever they might be located. With an overarching goal is the healthcare provider has some information and education and ultimately prescribes exercise to the patients that they see during that one-on-one time. With that prescription, patients or individuals they see can turn in that prescription for a 1-day free pass or a discounted annual pass to any of our South Dakota state parks with the goal of engaging in physical activity in that state park. So overall, ParkRx aims to increase education, assessment, and prescription of physical activity in that healthcare sector. Through our partnership with Game Fish and Parks, there's also a strong promotion to increase the usage and visibility of our South Dakota state parks. Additionally, provide resources and really that conversation starter between the healthcare provider and the individuals they're seeing to talk about physical activity and the benefits and physical activity as a form of treatment and prevention for some of the different chronic diseases we've talked and mentioned about today. So ParkRx was a specific program selected for focus on the priority 2.2 that relates back to what Lexi shared at the beginning in our state plan. Specifically through the partnership with the Cancer Coalition and the Cancer Program, goals around increasing promotion and enrollment from providers, specifically those providers that work with cancer patients or are cancer professionals is one of the main focuses. For example, I partnered with Lexi directly to do some email recruitment for some of the survivorship programs that Lexi works with in the state of South Dakota to encourage them to sign up for our ParkRx program. Next slide. So this slide here really just shows an overview of some numbers from 2021 and then also to date for 2022. So in 2021, we had a total of over 213 healthcare providers sign up to be ParkRx prescribers. Of those providers, of the patients they prescribed, 271 of them redeemed their prescription or kind of filled their prescription at a state park. Of those who did that, 86% redeemed an annual license. So with that, they get 50% off their annual license to our South Dakota state parks, which is really what we like to see because it does promote that long-term engagement in physical activity and long-term usage of our state parks. 14% redeemed it for a daily license, so a 1-day pass to enter one of our state parks. And of all the passes that were redeemed, 946 or over 946 people experienced our state parks. So that would be maybe if an individual came with a friend or a family of 4 attended a state park together. What we have for 2022 so far is 174 healthcare providers have signed up to be ParkRx providers for the program. So of the providers who have been involved with the program, we've had some professionals in oncology, pediatrics, physician assistants, psychiatrists, family practice doctors, nurse practitioners. So we've really seen a number of different healthcare professions engaged in the program, which has been just exciting and something that has really been a success of the program in general. So for ParkRx, and as Beth mentioned in one of her slides, we rely heavily on working through partnerships and with our partners. It also relies heavily on the participation and partnership with healthcare providers who sometimes do have some significant time constraints to their day-to-day job. So we have, as a program, we have regularly redesigned and improved the program and the delivery based on some provider feedback that we've received over the years. We also conduct an annual provider survey to make basically administration of the program as easy as we can for the providers and keep their engagement in the program around having those conversations around physical activity. Next slide. So I briefly touched on some of the successes of ParkRx, but one of those, again, just to reiterate, is the interest from multiple different healthcare professionals across multiple different disciplines. Another success has been our strong partnership across 3 of the state agencies, so SDSU Extension, South Dakota Game Fish and Parks, and South Dakota Department of Health. This partnership has been a strong catalyst and really strengthened the program and the provider knowledge and enrollment because of the state partners involved. Additionally, there have been some challenges along which we use hard copy prescriptions, which comes with pros and cons. We've had conversations of going electronic, ongoing engagement of providers. There's some barriers to tracking how many prescriptions were wrote out to patients. We're able to track on our end how many we send and how many are redeemed at a state park. And then also sometimes long driving distances to some of our state parks because they aren't in every community, but they're located within close range. But sometimes that driving distance can be a barrier. Next slide. So this slide really is just showing our strong partnership across our Office of Chronic Disease. Our nutrition and physical activity team works closely across multiple program areas. And within those multiple program areas, we work hard as a physical activity and nutrition team to ensure objectives and goals that relate back to physical activity are included in those state plans. Lexi shared some of the great initiatives already in the cancer plan. This other image here also shows some of the goals listed in our cardiovascular collaborative state plan. So Move Your Way and ParkRx are great statewide projects that really connect across multiple areas in the Office of Chronic Disease. So it's been a great partnership, and we're excited to really see what both these programs, the success we have in the years to come. Next slide. And this is our contact information for Lexi, myself, and Beth. And with that, I will turn it back over to Elizabeth.
Thank you all for your fantastic presentations. There's clearly so much work going on, and this is an incredibly important topic. And so we have planned for the rest of our time together to do a moderated Q&A session. I will ask all of our speakers at this time to turn on your videos, as well as our subject matter experts, Valerie, Jeff, and Maya. At this time, please feel free to continue to submit your questions into the Q&A chat, and we will do our best to get through as many as possible. As we have our moderated Q&A, I will note that several slides will circulate on the screen. Those will have resources that you may be interested in further perusing to learn more about the topics discussed during today's webinar. We already have several questions here submitted to our presenters, and so I'm just going to go ahead and dive in. The first question I will ask is for David regarding the tobacco use objective in particular that you highlighted. The question is, can you explain a little bit more about that break in trend in 2019 for the adult cigarette smoking due to the NHIS redesign?
Certainly, I'm happy to do that, Elizabeth. So I did briefly mention the 2019 HIS redesign in my presentation when describing trends for current adult cigarette smoking among males and females between 1965 and 2021. So there was a redesign of the HIS in that year, 2019, and it was designed to streamline both the content as well as the structure of the survey. In addition, there was also a change in the weighting approach that actually coincided with this questionnaire redesign that year. So although there have been some preliminary analyses that have been conducted to compare the data before and after this redesign in 2019 for many variables in the HIS, further analyses are needed to fully evaluate the effect of both the questionnaire redesign as well as the weighting change. So for now, the NCHS recommendation is to include a break in trend for charts that include HIS data both before and after 2019. I'll also note that for Healthy People 2030 objectives that use the NHIS as a data source, we have already or will be updating the baseline to 2019 or later so that the data are comparable using post-redesign data over the course of the decade.
Thank you so much, David. I have a question still on the topic of adult cigarette smoking, that objective in particular for our work group subject matter expert, Maya. Maya, we have a question for you about health equity and tobacco use. Particularly, how does the tobacco use objective, reduce cigarette smoking in adults, relate to health equity? Can you speak a little bit to this?
So commercial tobacco use is a health equity issue. There are a number of factors that link tobacco product use, including smoking, to disparities in disease, disability, and death in different groups. So for example, the tobacco industry specifically targets some groups and communities with marketing and advertising, which can drive up use. And then we also know that the pressures of discrimination and poverty can increase smoking and worsen health problems. There are also barriers for some people in accessing treatments that can help them quit smoking. So all of these factors and others can contribute to driving differences in tobacco use and tobacco-related disease. Of course, cigarette smoking affects nearly every organ in the body and causes a multitude of chronic diseases, including 12 types of cancer. So understanding and addressing what drives those differences in tobacco use is critical to advancing health equity to ensure that everyone has a fair and just opportunity to be as healthy as possible. And then in that resource slide that's circulating, we've also provided a link to our updated web pages that detail how health disparities relate to commercial tobacco use, including information on specific population groups.
Fantastic. Yes, and again, we encourage folks to check out these resources. They've been selected by our work group subject matter experts, so please do take note as they circle through. Our next question I have for Val. We saw in David's presentation on the HPV Healthy People objective that there didn't seem to be a noticeable disparities by race ethnicity for this objective. Can you share a little bit more about why that may be or why we're seeing this?
Sure. So racial and ethnic disparities in the uptake of HPV vaccine were prominent in the period following the introduction of HPV vaccines in 2006. However, they were not in the direction we typically see. Vaccination coverage, in fact, was higher among Black and Hispanic adolescents compared to white adolescents. Public health or provider efforts to reach all populations have been successful, as similar rates of HPV vaccination are now observed across Hispanic, white, and Black populations. Thank you.
Thank you, Val. Okay, our next question I have here, and I'm working quickly through my list trying to do that. Jeff, we have a question for you about the difference between physical activity guidelines. So we are obviously in the newer one from 2018, but curious about what you can share regarding the differences between the 2008 and the 2018 physical activity guidelines.
Yeah, happy to, Elizabeth. Thanks. I would start by saying that there were some additional health benefits recognized in the 2018 guidelines, in particular, some immediate health benefits that occur right after physical activity occurs, things like improved mood and improved sleep quality. But for the guidelines themselves, like the actual recommendations of how much to do, there were really just a few considerable changes. The first was that we added a guideline for preschool children, ages 3 through 5. And then for for adults, another considerable change was that we used to recommend in the previous edition that physical activity be accrued in periods of at least 10 minutes at a time. So, parking at the back of the parking lot and walking an additional 2 minutes to the front of the grocery store might not have counted towards your physical activity under the old guidelines. But enough evidence accrued since the 2018 guidelines that we removed that 10-minute bout in the 2018 guidelines. So now all physical activity counts towards that weekly guideline. And then I think another nice development in the 2018 guidelines was that we have an entire chapter in the guidelines document dedicated to strategies to increase physical activity. And these are evidence-based strategies that have been shown effective. And so people who are interested in applying those can use that as a resource on what to do in their communities.
Fantastic. Thank you, Jeff.
Sure.
Okay. Our next question here is for our lovely South Dakota presenters. The question is pertaining to collaborations that you all have had and interest around whether you have worked with tribal nations and related communities in the work that you highlighted.
I can start for South Dakota, and then Lexi and Beth, feel free to add if you have anything additional you'd like to share. So specifically for some of the projects I know we talked about today, we really come at it from a lens of a statewide approach. So our hopes is that we could reach multiple counties across our state of South Dakota. But specifically, I also work closely within our SDSU extension organization, which I briefly mentioned through our wellness coalitions. So through this work, we do specifically work with some wellness coalitions that SDSU Extension has staff that helps lead that wellness coalition. And those locations in our state are located in Standing Rock, Cheyenne River, Crow Creek, and Rosebud reservations in our state. So those are some specific areas of the state that I know we're doing some coalition work with, really the goals of improving access to healthy foods and improving access and opportunities for physical activity. So I'd love to chat more. There's probably more happening, but that's the specific areas I can think of right now. But I will also provide Lexi and Beth maybe an opportunity to expand if they would like.
No, thank you, Nikki. I have nothing to add. That was a great review.
Perfect. Thank you so much, Nikki. This question that I have is for both Jeffrey and our South Dakota speakers. And the question is, what do we know? What can we speak to as to why folks are not exercising as much as we would like for them to? And so, Jeffrey, I might pass it over to you first, and then I'll pass it over to our South Dakota speakers.
Yeah, sure. And I'll try to be brief, but I could talk about this topic for a very long time. So I think the first thing I would say is that I would encourage people to think of physical activity as stretching beyond just exercise. So exercise is a type of physical activity that's done with a very specific purpose to improve health or fitness or some other aspect of your physiology. Physical activity, on the other hand, can occur in any number of different contexts or domains. So you might think about walking to the grocery store or walking your child to school as being transportation oriented, but it's also physical activity. It's not necessarily exercise. So we have very specific things that are very specific definitions that we use around exercise. So I'll start by saying I would encourage you to think more broadly than just exercise. As far as the things that keep people from being physically active, we do know that lack of time is the most commonly reported obstacle, but there are also some pretty clear differences in barriers to physical activity, and there are some important health equity considerations around barriers to physical activity. And so in the National Health Interview Survey, the same survey system that David was showing, it's the only nationally representative health survey that has asked people about what are the barriers to walking near your home. And for example, some of the disparities that we found when we analyzed those questions were that Non-Hispanic Black adults were more likely to report crime as a barrier to walking near their home than other racial and ethnic groups. And so it's a good example of how there are definitely factors in the environment, whether it's the built environment or the social environment, that can impact physical activity behaviors. And those are not evenly distributed throughout the population. I'll stop there.
I know it was a big question, and we certainly could have a whole nother webinar on that. But I do want to acknowledge that we are nearing the close of our webinar. We do plan to distribute a recording of this webinar, which has all of these resources, as well as links to the important work that South Dakota is doing and featured in their presentation. So I know we're out of time for you all to respond to this question as well, but want to know folks can learn more at all of these web links and sites. I'll transition to the next slide to note that we do have the Healthy People 2030 Champion Program, which is an opportunity for organizations that are working to address the Healthy People 2030 vision and goals and objectives to join us in that effort. So we encourage you to apply to that. Please feel free to visit our website to learn more about our current champions as well as how to apply. Next slide, please. With that, I will adjourn our webinar for today. We thank you all for attending. Thank you to our presenters and our speakers for your valuable expertise. And we look forward to speaking with you all at our next Healthy People 2030 webinar. Thank you all.